Health, Dr. Zweli Mkhize now joins me on the line. A very good evening to you, Minister. Thank you very much for your time. Fresh into your new portfolio at the Pelonomi Hospital, of course. I'm sure this is quite embarrassing for your department.
It's a very embarrassing incident, particularly that the doctors a lot of them are very young people who have dedicated their lives to serving communities, and in that process, we expect that the hospital is respected by communities, by everybody. So for an incident like this, it has been quite embarrassing. We have met with the young doctor and spoken to the family as well. We gave them encouragement and support, but we also indicated that we're going to be with them all the way on dealing with this matter. I think what's important is to ensure that the hospital goes through a whole security review to ensure that the security is improved and upgraded. There are cameras, they must be properly manned, they must be properly manned. There are, gates with secret codes to go in.
Yeah.
They must be, corrected, and all of those things have to be really looked at. And we have said that the management, together with the senior leaders of units and community, must have a security committee that deals with any reports of suspicious behavior and breaks, and also reduce the number of people who move across the hospital from one area to the other using the hospital as a thoroughfare.
Yeah. Minister, of course, I mean, the hospital staff, had been up in arms since this incident had taken place. So what immediate measures do you think? I know this is a long-term process that needs to take place for security itself to be upgraded, but what immediate relief can be given to ensure that staff as well as patients at that particular facility are safe for now?
We have given directives that the provincial head of Department of Health must meet with the provincial commissioner of police to look into the issue of security. They must then bring in the security company on board and make sure that, the security detail of the whole hospital is up to standard. We've also said that they must deal with immediately the many thoroughfares around the hospital, make sure that people are, that these are meant. We met some of the doctors and staff who did say that they've already seen the security, started searching people who are going in. In the first instance, it should have been a routine that anyone who walks into the hospital gets searched and so on, because the fact that the culprit moved away and disappeared and was caught in another hospital means that the response time has to be improved in the security of the hospital.
Minister, safety seems to be a major concern when it comes to the country's hospitals. Obviously, you would have heard about the incident at Chris Hani Baragwanath Hospital where a baby was stolen and fortunately was found just hours ago. It looks like as you go into this new portfolio, safety is going to have to be one of the key issues that you deal with, because you've got this incident that took place at one of the biggest hospitals in the southern hemisphere where a baby was easily taken.
Well, they're all completely unacceptable. And we have then said that all the hospitals in the country must prioritize security. It's not only just security for the doctors in the form of people who just come from outside, even from the patients. And there have been instances of doctors who have been harmed by patients. Even members of the community must feel safe in there. So we have to take that issue quite strongly. And a lot of it is not like new money. It's about just tightening up on, strong supervision over the security over the area. The issue of baby snatching is something that happens every now and again, and the best way to deal with it in our instances is to be vigilant and to also look at where you've got cameras and where nurses also stick to the basic protocol and security to say, if you walk in, we must know who you are. If you get into the restricted areas, well, there must be clear identity of the people there. So vigilance is also very important.
Yeah. Minister, you have a mammoth task ahead of you here. I mean, some hospitals are being referred to as death hospitals. I mean, in Mamelodi, for example, you remember the incident of the 76-year-old Martha Murray who was tied to a bench. I mean, how far are the investigations after the two doctors, a nurse and a security guard, were placed on special leave? Are you able to give us an update regarding that?
Well, there is no new update here because the provincial department is conducting the investigations. They have actually put some staff members on precautionary suspension. They've gone through the process of taking statements from a number of individuals. It is clear that there was some possibly, lapse of judgment to allow a patient to be exposed in the way that she was. Of course, there were circumstances of the patient needing to be somehow in a restrained environment. But we think that there are a number of issues that have to come out of here. Firstly, we want to know if there was anyone who really transgressed. In that case, therefore, we need to take the specific action.
Yeah.
If there are other instances of, circumstances beyond the control of the staff, and some of the issues of, problems and inconveniences that the, staff and the community are reporting we have to deal with. I met with the community members yesterday. They did reflect a lot of unhappiness about the hospital. I've actually called upon the hospital management and the hospital board to call the community, go through all of these issues, solve what is possible to solve, and therefore escalate the others to the provincial and national government.
Yeah.
We said we'll stand by to be near the hospital so that we can actually assist and support where there's need for additional support to improve the care for the patients.
All right, Dr. Zweli Mkhize, the Minister of Health, thank you very much for joining us. We know you've had quite a busy day. Thanks for your time.